So the other thing that I looked at, obviously, while scanning your website, was to look at the videos that you share, which is you're sharing the actual procedures and you're showing what actually some of them is entailed. And while it seems pretty scary when you look at it, it's clearly quite it's just instruments. You're using these instruments, and you've just got the visual of the camera to so your hand-eye coordination would have to be really good and very steady. So I guess my next question was to ask you, if feasible, for you to share perhaps an experience that was really challenging, really challenged your skills. Because I mean, for me, just to play a computer game where you're trying to make someone run across a screen, and you're like, I don't, it's impossible sometimes. But for you to be able to do that, I think is, obviously takes practice and time. But can you share an experience with us?
Well, I think in whatever sort of surgery they do, whether it's open surgery or whether it's laparoscopic surgery, I think you have to keep a cool head. You have to be very, very control of your senses, as well as you got to be very, very calm in whatever adversities that you face. And I had a patient once. It's not laparoscopic surgery, but it's actually a pregnancy. And this girl was happened to be in Klang when I was in the government sector. She actually had what was known as an abdominal pregnancy. Which means,
ectopic sort of.
Correct. So it started off as an ectopic pregnancy.
Oh, yeah.
And it grew, and it grew outside the uterus.
Doesn't it burst the fallopian tube?
Well, most of them do.
But it kept growing.
But like I said, many things happen in Klang.
Yeah. Oh my God, that has been so painful.
So retrospectively, we found out it's 0.04% in the world.
Oh my God.
Where you have this baby which she grew up to about 2.8 kilos. And she came to us, and we were all following up in this one, thinking that it's in the uterus and blah blah blah, and things like that. And my specialist, we put up for a cesarean section, thinking that it is a placenta previa, which is a placenta which presents in front of the baby.
Okay.
But what we were actually looking at was that it was a previa, yes, but the previa was actually in the abdomen. It was outside the uterus. So as soon as we cut the skin and delivered the baby, she just collapsed.
Oh God.
She collapsed, and her blood pressure became very low. She was a 23-year-old girl. And they called me because I was the guy on oncologist around. This happened back in 2004, 2005. We all ran in.
Oh my God!
And we tried to save we saved the baby. The baby was out, but she was bleeding profusely. She was
so
just
what
bleeding.
They would have cut into the abdomen.
So they cut into the amniotic sac.
Yeah.
Delivered the baby.
Yeah.
And then they found out
it's not even in the uterus.
It's not even in the uterus. The uterus is down there.
Oh my God.
And she's delivered here. Oh my God. And she's bleeding because the placenta is now separated, and it was hitting the major vessels of the tummy. She was bleeding into the aorta, she was bleeding into the vessels and all that. And at that point, we had a surgeon from India who had come and said, look, if you're facing, I said, call the surgeons because, we need help. I'm a gynae oncologist, but I need help.
Yeah.
So he came and he did something, and then he said, look, I can't do anything beyond this. We've got to get more help. So we had to call the chief of surgery.
Yeah.
And when he came in, he said, look, I've not seen something. I said, neither have I. So what are we going to do? He said, well, we just have to take out the placenta piecemeal because the placenta is bleeding.
Okay.
And it was such that, we were compressing the tummy with all these pieces of gauze and, thing. And in between the compression, you could see the blood still oozing out because that's how fast the aorta was pumping.
Oh my goodness.
And we had 5 anesthetists with us. And we were pumping blood and things like that. And finally the surgeon said, okay, I will pull up the placenta, you cut the placenta and you tie. And so we had to do coordinated action, remove the placenta piecemeal and sort of compress. And then he said, look, I don't know what you do, but you have to compress now the pelvic region such that the blood does not ooze out like that. So we do very, very unconventional, unspoken of methods in medicine, where I had to make a big hole at the side of her tummy and tie down 2 bottles of saline to compress the gauze pieces into her tummy and send her to ICU.
Oh my God.
And as I was writing up the notes, I said, okay, fine. I was just talking to her, yeah, it's hours. Surgery was 6 hours. So I told let's go, okay, what's the blood loss? The answer is 30 liters. Is it 30 liters or 13 liters? Because a person has got 5 liters of blood. Is it 30 liters? I said, yeah, it's 30 liters. I said, how did you get 30 liters? He said, well, while you were operating, we sent off 2 ambulances to the National Blood Transfusion Center. We got this one and we transfused until we finished operating for 6 hours.
Oh my goodness.
So the anesthetists managed to keep this patient alive, and they without us talking, because we were sweating, we were focused on this
trying
surgery,
to seal that.
and she went back to ICU, and the chief hematologist called me up and said, "You've just used up all the blood in this hospital for this patient. So what's going on?" She said, "We've had this patient and all that." And she said, "Well, I've got this drug. It's called Novo 7. This is back in 2004. I said, "What is this drug about?" She said, "Well, it's a certain coagulation factor drug, but it costs us a lot of money." I said, "How much money?" And she said, "Well, it costs about Australian dollars at that point, 7,000 Aussie to treat this patient." So I called up the director of the hospital and said, "Look, I need this drug." He said, "What is it for?" I said, "It's for a mother. If you don't give this drug, she's going to die tomorrow. She's going to be a statistic. She's 23 years old. I need this drug today." I said, "Fine, pass it." We gave the drug. She walked out of hospital in 2 days with her baby, out of ICU. In 3 days, she walked back home. I got a picture of the baby and the mother. And when I went to UK after that, 2006, 2007, and this was the first time they were using Novo 7 in UK. And I said, "Hey guys, you guys are backward. We've actually used this before."
So what is the Novo 7? Is a drug?
It's an anticoagulant sort of factor. Which blocked, and we had the first opportunity to use it in Southeast Asia. And I said, I've actually used this drug, and then when I went back and someone said, "Why did you write this up?" So when I looked at the literature, 0.004% where in the world an ectopic pregnancy has actually become a normal baby
that's very rare. Because
very rare.
I've heard of ectopic pregnancies basically, leading to a bleed out because of people have to remove it.
That's a usual thing for us, but this baby actually grew.
Just grew in there, and she didn't feel the pain.
She didn't feel nothing. I think she was fine. She was okay.
Gosh. Well, that's a really. Thank you for sharing that. That's an insightful.
Welcome to
very, very challenging and complex environment. Clearly, you had a good team around you, because for the anesthetics to do what they had to do to keep the patient alive, and you focus on that to make sure.
Brilliant. They didn't just step in and say, "Look, stop."
Yeah, because 30 liters.
Keep quiet and just get what you're supposed to do.
Just keep this person pumping.
And get this sorted out. We had when push comes to shove, and we needed that 20,000 ringgit worth of the Novo 7.
At least
gave it to us.
Yeah, that's right.
They gave it to us, and because they said, "No, we do not want a maternal mortality on a 23-year-old girl. If we can avoid it,
when you can afford to save the life."
To save the life of the mother, and they did it.
So just out of curiosity, did the patient know what she had gone through?
Oh yes, of course. Because she came back to the clinic, and
was
she told her what actually happened, and of course she's very grateful.
Yeah.
And I said, "Please do not have another pregnancy."
Yeah, don't do this. Don't do this to us again. That would just be terrible.